Good afternoon, dear students. As you all know that we are doing chapter Why Do We Fall Ill, and today we will discuss about some of the communicable diseases. Communicable diseases are also called the infectious diseases and means the diseases which get spread from an infected person to a healthy person are known as the communicable diseases. Now, students, you are also know that what are the causative agents for the communicable diseases. So, microorganisms like bacteria, virus, protozoans, nematodes. So, these are the causative agents for the communicable diseases, and today we will discuss about some of the bacterial diseases. So, diarrhea, cholera, tuberculosis and typhoid are the common bacterial diseases. Firstly, we will discuss about the diarrhea. So, diarrhea is caused by the bacteria Escherichia coli, Salmonella, Clostridium, Campylobacter jejuni and Shigella dysentery. Besides the bacteria, some protozoans like Entamoeba histolytica, Giardia intestinalis, and Balanterium coli, viruses like rotavirus, adenovirus, enterovirus, and nematodes like Ascaris. These also cause the diarrhea. Diarrhea is an abnormally frequent discharge of semi-solid or fluid feces which occurs due to intestinal infections and food poisoning. Now, what are the modes of transmission? So, diarrhea gets transmitted through contaminated food and water, and this also gets transmitted through contaminated household things like clothes, bed sheets and utensils. Now, let's discuss about the symptoms of the diarrhea. So, frequent watery stools with or without mucus and blood, abdominal cramps and pain, nausea, vomiting, dehydration, sudden loss of weight is also one of the symptom of the diarrhea, and patient also feels low blood pressure, increased pulse rate and fever. How can we prevent the diarrhea? What are the preventive measures that can be taken against the diarrhea? So, firstly, a patient should take care of proper personal and community hygiene, keeping the eatables thing covered to avoid the contamination, drinking clean water and proper cooked food, proper disposal of human excreta should be there, and proper wire netting of doors and windows should be there in the homes so that it can prevent the entries of house fly to enter the houses. Now, how can we control it? So, to controlling the diarrhea, complete bed rest and use of antidiarrheal antibiotics is required. Use of oral rehydration solution, pulp of boiled unripe banana and required amount of salt, turmeric and lime is helpful to control the diarrhea and provide the relief. Isbogol seeds with curd should be given to the patients for relief, and saline drip may be given intravenously to control the diarrhea. Now, let's discuss about the cholera. So, what is cholera? Cholera is also a type of communicable disease which is an acute infectious and fatal disease, and it is more common after floods and often occurs as an epidemic which affects a large population or the large number of people, and it is caused by the bacterium Vibrio cholerae, and the incubation period for cholera is a few hours to 2-3 days, and the bacteria of cholera infect the small intestine and invade its epithelial cells. After the death of bacteria, a toxin is released that irritates the intestinal lining and leads to loss of excess water and salt. What are the modes of transmission of cholera? So, cholera transmitted through contaminated food and contaminated water and through the house flies. Now, let's discuss about the symptoms of the cholera. So, watery stools, vomiting, dehydration, muscle cramps and weight loss. Cholera can also lead to the kidney failure due to loss of mineral, salts and body fluids, and sunken eyes is also one of the symptom of the cholera. Now, how can we control and prevent the cholera? So, use of oral rehydration solution is required to prevent the dehydration. Use of antibiotics like tetracycline which kills the intestinal bacteria. Immunization can be provided against the cholera by standard cholera vaccine and by maintaining the proper hygiene and good sanitation in the community we can prevent and control the cholera. Now, what is the next disease? Next disease is the tuberculosis, which is commonly known as the TB, and TB is caused by the bacteria Mycobacterium tuberculosis. This bacteria releases the toxin called the tuberculin, which mostly affects the lungs along with other body parts including bones, intestine and lymph nodes. Okay. And students, the incubation period of TB, it includes a few weeks to a few years. The undernourished people who live in a congested part of big cities are mostly affected by the tuberculosis. Now, what are the modes of transmission? So, tuberculosis can be transmitted by two ways, by direct mode of transmission and indirect mode of transmission. Direct transmission by coughing, sneezing and spitting, and indirect transmission by air. Now let's discuss about the symptoms of the TB. So general weakness, loss of appetite and weight is the common symptom for TB. Typical fever pattern, night sweating, and if the pulmonary TB is there, lungs TB, then fever, persistent coughing, chest pain, breathlessness, blood in sputum, local inflammation and abscess in lungs, which leaves scar after healing, and this scar is observed through the x-rays. And if it is lymph gland TB, then swelling and tenderness of lymph glands is one of the symptom of the tuberculosis. Now, how can we control and prevent the TB? So TB can be controlled or prevented by using ATT, means anti-tubercular therapy, a complete course of drugs, means antibiotics including rifampicin, streptomycin, parazinamide, ethambutol, okay, and thioacetozone. So these are the antibiotics that a TB patient should take. Immunization should be provided with BCG vaccine. BCG means Bacillus calmette-guerin vaccine, which gives immunity for 3 to 5 years. Keeping the TB patient in complete isolation. Avoid spitting at public places and use handkerchief when coughing and sneezing. Educating people about the disease, and we should avoid the overcrowded areas. Provision of good ventilation and better nutrition help to reduce the incidence of the disease. So by following these things, we can prevent and control the TB easily. Next disease is typhoid. Typhoid is most communicable disease which is caused by Salmonella typhi. Salmonella typhi is a rod-shaped bacteria which is found in the intestine of humans, and it is common in age group at 1 to 15 years. Or which test is used for diagnosing the typhoid? So Widal test is used for diagnosis of typhoid. And students, you should also know that about 2.5 million people suffer from the typhoid every year. Now let's discuss about the modes of the transmission. So through ingestion of food and water which is contaminated with fecal matter of patients, transmitted through houseflies, the symptom appear 10 to 14 days of the infection. Now what are the symptoms? Headache and fever, which increases each day in first week. So during second week, the patient experiences persistent high fever and then slow decreases there in fever, and during the third and fourth week. Rashes on the upper abdomen and slow pulse. Diarrhea with green stools, abdominal pain, constipation, and sometimes inflammation in liver and colon. So these are the main symptoms for the disease. Now, what are the preventive measures, or how can we control and prevent the disease typhoid? So immunization with TAB vaccine, and TAB vaccine prevents typhoid for at least 2 years, and typhoid oral vaccines are also given to prevent the disease. Now by drinking the clean and disinfected water, proper cooked food should be there, and we should also maintain the proper underground disposal of human feces. So by following these things, we can prevent the